Hello, I'm Nilma. I'm an optometrist at Specsavers, and today we're going to talk about eye infections or red eyes in children, how to recognize them, what to do about them, and when to seek professional help. First, let's talk about the symptoms. You might notice that your child's eyes start to become red, swollen, and possibly itchy. There could be discharge that may be clear, yellow, or greenish. And your child might be more sensitive to light and complain of a gritty feeling in their eye. What should you do if your child has an eye infection? If you suspect that your child has an eye infection or a red eye, the first step is to keep their eye clean. Use a clean, damp cloth to gently wipe away any discharge. Make sure that your child does not touch or rub their eyes, as this could spread the infection or make the irritation worse. Wash your hands and your child's hands frequently to stop the infection from spreading to other family members, and we would recommend not sharing towels. The most important thing is to get advice, so contact your local opticians and they can guide you as to what to do next and arrange an appointment to be seen. Can a child go to school or nursery with an eye infection or a red eye? It's best to keep your child at home until the infection is cleared up, especially if there's a lot of fluid or pus. This helps prevent the spreading of infection to other children. Don't forget to check in with your school or nursery, as they usually have a policy on this. How should you treat a child's eye infection? Well, treatment depends on the cause. For certain infections or irritation, your GP or optician may prescribe eye drops or ointments, some of which may be antibiotics. Many infections or irritations usually clear up on their own, but you can help ease the symptoms with cool compresses and keeping the eye clean. If the infection doesn't improve after a few days or gets worse, it's important to seek medical advice. When should you see an optician or a GP? If your child's symptoms are severe, persist for more than a few days, or if they have pain, vision changes, or a high fever, it's time to get professional help. Both your GP and local opticians can help manage and treat eye infections, so don't hesitate to reach out at any stage for advice. The important thing to remember is that these things are quite common in children and usually easy to manage. By keeping a lookout for symptoms and getting the right treatment, your child will be back to their normal selves in no time. If you're worried about your child having symptoms of an eye infection or concerned about anything to do with their eye health, please contact your local optician.